What if the most dangerous disease in your body right now is not hidden deep inside your organs, but sitting right there, at the tips of your fingers, and you have been looking at it every single day without knowing? What if your nails have been screaming for help for months, maybe even years, and you thought it was just dirt or age, or maybe that old nail polish you forgot to remove? What if ignoring those tiny changes on your fingernails is the most deadly mistake you will ever make in your entire life? Stop whatever you are doing. Hold up your hand. Look at your nails right now. Really look at them. Because what you are about to learn in the next few minutes could either save your life or make you realize you should have taken action a very long time ago. Nails as health mirrors. Fingernails reflect the internal health of liver, heart, lungs, kidneys, and blood. Any color, texture, or shape change is the body's silent alarm system. Most people miss the warning. Because nail changes happen gradually, people dismiss them as cosmetic issues, aging, dirt, or nail polish damage, when they could be early signs of serious disease. 7 deadly warning signs: pale/white nails, anemia, liver disease; yellow nails, lung or fungal/diabetes; blue nails, oxygen deficiency; pitted nails, psoriasis/autoimmune; clubbing, heart/lung failure; dark streaks, melanoma; and spoon nails, iron deficiency/heart disease. Time is the deciding factor. All 7 signs, if caught early, allow treatment. If ignored for months or years, they can escalate to organ failure, cancer spread, or cardiac arrest. Self-examination is free. Unlike MRIs or blood tests, nail inspection costs nothing. A 30-second look under good light every week can save your life. Doctor visits are constantly delayed. Studies show people wait an average of 3.5 years before reporting a persistent nail symptom to a doctor. By then, the condition is often advanced. Your body does not suddenly break down. It whispers before it screams. It gives you signs. Quiet, subtle, easy to miss signs, long before the disease reaches a critical stage. And one of the most powerful, most overlooked places where your body sends these signals is your nails. Not your chest, not your stomach, your nails. The science behind this is not new. Physicians have studied nail health for over 150 years. Ancient doctors used nail color and texture as a primary diagnostic tool. But somewhere between the age of smartphones and fast food, we stopped looking. We stopped listening, and that silence is costing people their lives. Pale or white nails. If your nails have lost their natural pinkish color and now appear pale, whitish, or almost translucent, your body is sending a critical alarm. This can be one of the earliest visible indicators of severe anemia, where your blood lacks sufficient red blood cells, or early-stage liver disease, where the organ responsible for filtering your entire blood supply begins to quietly fail. In some cases, it has also been connected to congestive heart failure. People walk around for years thinking their pale nails are just a vitamin issue or winter dryness. Meanwhile, their liver is struggling every single day. Yellow nails. Yellow nails are not just ugly, they are a warning. When your nails turn yellow and begin to thicken, peel, or pull away from the nail bed, this can indicate a serious lung infection, chronic bronchitis, or even early signs of diabetes. In diabetic patients, poor circulation and high sugar levels create the perfect environment for fungal infections to deeply penetrate the nail structure. But here is what makes yellow nails especially dangerous. People almost always blame nail polish or aging and never visit a doctor. By the time they do, the underlying condition has already progressed significantly. Blue or purple nails. This one is a 911 moment. When your nails turn blue or purple, especially at the base or around the edges, it means your blood is not carrying enough oxygen. This is called cyanosis. It can be triggered by severe respiratory disease, a failing heart, or blocked arteries. If you press on a blue nail and the color does not return to pink within 2 seconds, you need medical attention immediately. People have sat at home thinking they were just cold, just tired, just dehydrated, while their heart was already under catastrophic stress. Pitting. Small dents across the nail surface. Look closely at the surface of your nails. Do you see tiny little dents, holes, or rough pits scattered across the top? This is one of the most underdiagnosed nail signs in the world. Nail pitting is strongly linked to psoriasis, an autoimmune disease affecting 125 million people globally, and psoriatic arthritis, which can permanently damage your joints if left untreated. It is also connected to alopecia areata, an immune condition that causes unpredictable hair loss. Most people think pitted nails are just from pressing too hard on a keyboard or doing physical work. They are not. Clubbing, when your fingertips swell and curve downward. This one is devastating. Clubbing happens when the soft tissue under the nail thickens, causing the fingertip to round outward and the nail to curve downward like a spoon turned upside down. This is one of the most serious signs the body can display. It is heavily associated with advanced lung disease, heart defects, liver cirrhosis, and certain aggressive cancers of the bowel and lungs. If you look at someone with clubbed nails and think it just looks like they have fat fingers, you might be looking at someone whose heart or lungs are already severely compromised. Dark streaks or black lines running down the nail. This is the one that doctors fear most. A dark vertical line running from the base to the tip of the nail, especially if it is brown or black. If it bleeds, if it has irregular edges, or if it is getting wider, can be a sign of subungual melanoma. That is nail cancer. It is one of the most aggressive and fastest spreading forms of skin cancer, and it is almost always ignored because people assume the dark line is a bruise from a door, a counter, or some old injury they forgot about. Bob Marley, one of the greatest musicians who ever lived, died from a melanoma that started under his nail and was ignored for too long. Spoon nails. When your nail curves up like a bowl. Instead of curving outward like clubbing, spoon nails, also known as koilonychia, curve inward, creating a visible dip in the center of the nail, deep enough to hold a drop of water. This is a direct and well-documented sign of severe iron deficiency anemia. When your body lacks iron, the nail structure weakens and literally changes shape to reflect what is happening inside. Spoon nails are also associated with heart disease and hemochromatosis, a dangerous condition where the body absorbs too much iron and begins to deposit it in the organs, slowly destroying the liver, heart, and pancreas. 7 silent screams from your body. And every single one of them is invisible to people who have been trained by modern life to look at their nails only when they want to paint them. The terrifying truth is this: you are not sick today because your body failed to warn you. You are sick because no one ever taught you how to listen. The body is always communicating. The language is written in places most people never think to look, and the nails are one of the most honest storytellers the human body has. A simple habit, once a week. Good light, clean hands, 30 seconds. Look at the color, look at the surface, look at the shape, look at the edges. Notice if anything has changed. And if something has changed, especially if it has been there for more than 2 to 4 weeks, go see a doctor. Not tomorrow, not next month, go. Because the gap between an early diagnosis and a late diagnosis is not just medical. It is the difference between a treatment plan and a funeral. Your nails are not decoration. They are documentation, a live, real-time record of everything happening inside your body right now. Pale nails, yellow nails, blue nails, pitting, clubbing, dark streaks, spoon nails. Each one carries a message that no blood test or MRI can deliver as quickly and freely as this simple daily observation. The 7 signs discussed today are not rare. They are happening to people around you, possibly to you, right now. The only question is whether you will recognize them in time. Take 30 seconds today. Look at your hands. Your life may literally depend on it. Thank you so much for watching until the very end. That tells me you care about your health, and that matters more than you know. Take this knowledge, share it with someone you love, and remember, the body never lies. It only waits for you to listen. Good luck, stay healthy, stay aware, and never stop paying attention to the little things. Because sometimes the little things are everything.